on 4 key areas. On the operation of Social Health Authority, the operation of Digital Health Agency, how we are reforming and increasing the fill rate of KEMSA from 51% to 90% by putting more money, both government and the private sector. The issue of how we have dealt with perennial healthcare workforce dispute, and I want to thank the committee for giving us enough resources, including UHC, which we are going to turn them into permanent and pensionable after we do a countrywide audit, which has started today. Both my PS and the CEO of Council of Governors have begun this morning. And thirdly, I am ready to answer to the issues raised on bed capacity, why we are closing fraudulent, fake, ghost facilities, mainly in private and faith-based, mainly in the private, in fact. And finally, give update on the registration of SHA, both those who will access the primary health care, those who will access SHIF, that is the insurance part of it, and how we are going to deal with the matter of emergency chronic illness fund, which Parliament has given us money. And of course, with the Council of Governors, KEMSA is both our baby, because we are supplying drugs to the last mile, facilities owned by the councils of governors, like our county leaders. And secondly, on the National Equipment Program, which again, we work in collaboration with counties on the matter of fee for service, where the national government is not paying for the equipment, the county government is not paying for the equipment, the Kenya citizens are not paying for, but that vendor and supplier will be paid for his CT scan, for his dialysis machine, by SHA, based on the number of citizens who use that facility. So we have not finished. KEMSA has not presented yet. And Kenya Medical Practitioners and Dentists Council, our regulator, has not presented. So that's all I can say.
The issues that are arising, and I know the 3 issues that are of concern to the public now is the issue of registration, which earlier on was going on and with the monthly installments, and now is coming as lump sum. And they have given us the information on why this is so and what they are planning to do, which they are going to give us in our next sitting. And we are keen that whatever happens, we must make it possible for members of the public to pay, if by installment in some way, that is manageable to them. And that is what we are going to next. In the issues of facilities that are now not working, they have explained to us the issues that to deal with issues of fraud that they are concerned with. We have had those. There are some that may be acceptable, some not, and we are going to also get full information and the way forward in this matter. There are issues of availability of drugs in the health facilities that we have not touched. KEMSA is going to give us a presentation in the next session in the afternoon. We know that in the budget we have put money for the implementation of primary health care and also emergency and chronic illness fund. And this is they are going to tell us exactly in the afternoon how this money is be utilized, so that in level 2, level 3 and outpatient in level 4, people can get treatment without paying as is expected, because money is now available. How that will happen.
Our primary concern to us as Council of Governors, which we expect to be addressed today, are about 3 issues. The first issue is the one the minister has talked about, and that is the issue of the bed capacity for the facilities in an effort to curb fraud, which the CS rightfully put that is mostly in private sector. We have found some public facilities also in the crossfire, not necessarily because they have fraud, but because they have not updated their records with the KMPDC on the bed capacity. So our belief is that the records that the ministry is using or SHA is using to remunerate the facilities on the bed capacity is outdated. Whereas the minister has requested that we update those records now. If you look at the 47 county governments and the facilities are there, it will definitely take a bit of time because we only have one KPDC in handling those records. The disease burden cannot wait, and therefore we are requesting the ministry, and we hope that the committee will back us up on that, for a grace period on updating the bed capacity with the KMPDC. Should there be found a situation whereby fraud was committed, then the minister and SHA are at liberty to recover such monies or such funds that will be paid fraudulently. We agree to that. But in the meantime, as we wait, let our patients not suffer because of not getting admission. You find a hospital that has got 100%, maybe 300 bed capacity, but what is in the record is only 150. What happens to other patients who use those beds? That is the problem at the moment. The second issue, which also the minister rightfully put, is the issue of UG staff, which we agree, as we stand here, that their contract ends next year, probably around May to June. They are still asking to be absorbed in permanent and pensionable. Well, we admit that you cannot be absorbed when you still have another contract. All they need is just a level of comfort, an affirmation that they'll be absorbed. And that can only be confirmed if they are funds that have been put aside or have been appropriated by Parliament on absorption of this staff. However, it is not possible to have a budget in the year 2025, 2026 of funds that will be used in 2026, 2027. So there should be an undertaking that this will be factored in 2026, 2027, so that these UG staff, most of them who are currently out on the streets, are not working in the hospitals and yet being paid because some counties have not reported on those who are out in the street, which is a waste of taxpayers' money. And I agree with the CS. We need to do an audit, which is starting this week, to affirm who is in the facilities and who is not there. And if there are staff who are found to have been earning salary without providing any service, that money should be recovered, if possible, CS with interest, because that is a theft to taxpayers' money. And the last issue is on the SHA lockout of civil servants, that we are supposed to pay SHA by 9th of every month. The release of funds from the exchequer to counties, I'm not very sure about the ministries, most of the times is delayed even by 2 months. And most of the times it comes past the 9th of the month. And what happens is that whereas we miss out on the privileges of the service of SHA when we are locked out every 9th, when the money comes late, we still pay. It means we are paying for stuff without having any services. So the Committee on Health, put your heads together and recommend a way we can be able to exempt this staff of the counties and the national government who have their share remitted past 9th, yet they still pay, but they miss out on the services that are supposed to be offered.